Welcome back into Wisconsin Women, and we are Wisconsin Women here having a lovely time at Crazy Lenny's e-bikes off of Odana Road. Later in the program, we'll have Crazy Lenny himself talking about preparing for spring. Right now, though, we're going to check in with Dr. Ashley Woyak. She's with Forward Natural Medicine, and we always have some really good topics with Dr. Ashley. Today, we're talking about thyroid health, something that you might be wondering about at home. Thanks for being on the program.
Yeah, thank you for having me.
So for women who are watching, what are some signs that we might be having thyroid problems?
Yeah, so there's a couple really common ones. Fatigue or brain fog is huge. You can't lose weight no matter all the dieting, gym membership stuff you do. Dry skin, like brittle hair or hair that's kind of falling out. It can be in clumps or just you're noticing in the shower, like, oh my gosh, where is this coming from? Constipation or digestive issues, those are kind of the big ones, but there's a variety.
And there's probably a lot of people that have some of those issues and don't ever think that there's really an issue. This is just how they live.
Right.
Yeah, or
like you think it's
oh,
a day-to-day kind of thing.
Exactly.
Yeah.
My dad's age or something.
Right.
And that's not it at all.
You blame it on the winter or
Right.
whatever it is.
Yeah.
Yeah. And how can stress cause a thyroid
Yeah, and
issue?
that's in our modern world today, all of us are stressed out, especially moms, you know, with kids or working and whatnot. Stress, if we have a ton of it, can release, it's called a hormone called cortisol. A lot of people have kind of heard that before. When we have too much of that, that can actually decrease our thyroid response. It can either lower TSH, like from our brain, some people are familiar with that marker, or our thyroid actually isn't making enough hormones. So if that's the case, we've kind of got to look into that. And I understand we all have stress, but it's more if you're dealing with a lot of it right now, if this is just a season of your life, how can we support that so you feel better? So,
Right.
Gosh, stress is like, I tell you, I'm like, I need you right now. Fatigue, you know, this winter's really got me stressed.
Right.
But let's talk about Hashimoto's disease and what is it?
A lot of women who have thyroid problems haven't heard about it before. It's when your immune system actually is attacking your thyroid for some reason. So it's called autoimmunity, meaning your own body is attacking your thyroid. So you can test to see if you have it for antibodies, and a lot of doctors don't do it because if you have it, their treatment really is the same. You just take a medication, but at the end of the day, it's kind of just a Band-Aid, like a quick fix to help symptoms, but you're not figuring out why is your immune system doing that? Like something's triggering your immune system to attack your thyroid, and that's where I come in, like, let's figure this out. So long term, it's not keep happening and happening. So.
Well, and that's what's so smart about what you're doing is you're not just going to sort of mask the symptom. You're looking for the underlying cause so that you can heal somebody for what they're dealing with to begin with, which could heal a host of problems.
Exactly.
But one of the questions that I have is for people who are taking thyroid medication, why does that sometimes not work?
Yeah, so if we go back to the Hashimoto's case, or an example, if you're taking medications, it might help your symptoms for a week, a couple weeks, a couple months, but then eventually it's not enough anymore, and your immune response is still happening that whole time you're taking that medication. So eventually you're going to feel awful again. Your symptoms are going to return. You're going to have good days, you're going to have bad days, and then your doctor is just going to constantly adjust your medication. Really, you know, they'll just follow a number. And then also too, you might not have Hashimoto's, but you could have other issues going on, whether it be your adrenals with stress, your gut, or your liver, and that's causing your thyroid problems. So that's not getting to the root cause either. You're just taking a pill to
It's
to
kind
mask
of
your
like
symptoms.
a vicious cycle,
It
right?
is.
We just keep
Yes.
taking more medication and those symptoms keep getting worse. They're still there.
Yes, and sometimes people think like TSH is a good indicator, and sometimes it's not. Right?
Yeah, that's the one most women are familiar with. That's why I bring it up, because if you've gone to the doctor and you've said I'm fatigued, no energy, they'll run TSH. But I do almost 10 different thyroid markers that you really should be checking, because TSH actually isn't the best one. So we look at that, and that gives me a good idea of where your problem is actually happening and why. So yeah, that's something really
That's
important
good to
do.
know.
And I want to mention that your approach is really different. We've just got about 30 seconds left, but talk to us about that.
Yes, so, and nothing against medical system, we definitely need medications when we need them, and I work hand in hand with most patients' doctors, because we do need a collaborative, integrative system for the patient, what's best for them. But whereas they use a lot of medications for symptoms approach, I'm trying to figure out why do you have these issues, what's causing them, and how can we, approach it and work with it in a more natural way.
Right. So I love
And my
that.
goal too, like, I don't want to just get someone better and then send them out to the world. It's
Right.
like, how can I
Right.
educate you so your health is in your hands the rest of your life?
Wow.
That's a great
That
approach.
sounds like good news for a lot of us who are
Yeah.
dealing with brain fog, weight loss issues, all of those things. Dr. Ashley is with Forward Natural Medicine, and we're Wisconsin Women. We'll be right back.